Here is Dinesh Sidhu, a struggling entrepreneur who's finding it difficult to combat his mental illness of bulimia nervosa. Dinesh Sidhu is not alone, as every 62 minutes, at least one person dies from the direct effect of an eating disorder. He has to manage so much, from his context to his diet plan, that he's finding it impossible to do anything except fight his condition. This is when Calvosa comes in. Calvosa is an application that creates a bridge between patients and healthcare professionals no matter where they are. Our app allows patients, such as Dinesh, to consult and speak with his dietitian and other vital professionals when and wherever he feels comfortable. Not only that, professionals that work with Dinesh can provide a plethora of information to him, from his diet plan to what he's supposed to collect at his nearest pharmacy. Our application provides the perfect balance between being effective and being efficient for the needs of an individual like Dinesh.
Dinesh opens Calvosa. He is greeted with a mood-enlightening user interface that includes pleasant colors and gratifying shapes. At the home screen, he can click on the dietitian button to view his dietitian's information, such as his or her email and phone number. The psychiatrist button offers similar features as well. Back at the homepage, tapping the pharmacy button allows Dinesh to view the closest pharmacy to his location, as well as the drugs that have been prescribed by his health professionals. With our technology, the doctor's signature is also written, so he does not have to bring his prescription along with him on his trips to the pharmacy. Using the hospital button, he can view the closest hospital to his location. On Calvosa's home screen, Dinesh can also open the family contacts page. Here, he is able to view and edit the information of his family members or close friends. This comes into assistance if anything happens to him, as people would know who to contact in his family and how. If Dinesh ever requires bulimia-related assistance, he can immediately contact the National Eating Disorder Information Center with the NEDIC helpline button on the homepage. This will immediately contact NEDIC, who can assist in any inconveniences he is experiencing. Once Dinesh clicks the diet plan button at the bottom left corner of the application, he is able to access his diet plan information for the following month. He can specifically see what he is supposed to eat once he clicks the date. Let's take a look at what his dietitian has assigned him today. Dinesh is able to view what he needs to eat throughout the day and how much. Another crucial feature of Calvosa is the emergency call button, which is something our team has already programmed.
Right now, I will be explaining the code we would use for the emergency button feature. Looking at the program, even though it is small, it does the job we want it to accomplish. While most of the code is for front-end development, this key line over here is used for the back-end. In this line over here, we tell the computer when this linked image is clicked, it prompts the user to call who it is connected to. In Calvosa, the user would have to put his psychiatrist's contact details when he makes an account. So the psychiatrist's phone number would be automatically plugged into the code. Let's see how it works in real life. Here's the phone of a patient like Dinesh, and he's currently having a panic attack. He simply goes on application and clicks this button. As you can see, it immediately calls the phone of Happy, who is his psychiatrist.
An integral part of Calvosa is producing a well-prepared business plan to increase users and get investment on our application. The problem we are attempting to solve is the lack of communication between distressed patients and healthcare professionals such as dietitians. Several patients, such as Dinesh, have to go place to place just to receive care for their condition, and due to a frequent lack of communication, this results in tremendous stress for the patient. While we cannot identify any clear competition right now, we are strongly prepared for other applications trying to copy us. And in order to combat this, we will be putting constant updates to keep our customers engaged. For the price of our application, we will be charging each clinic on a subscription method. This is extremely cost effective for these clinics, as with this subscription, they can use it on infinite patients instead of a per patient cost. For our place, we will be offering our application through the Apple App Store and Google Play Store, so our users can use our services no matter what phone they have. For our market plan, we would first like to go to some investors so we can obtain some funding. With the funding, we would start the development of our application and website while focusing on our launch marketing, which includes social media marketing and radio commercials. When it comes to finding the right partner, we have decided to pair up with an organization called NEDIC. NEDIC is an organization that supports people impacted by eating disorders such as anorexia nervosa and bulimia nervosa. Working with them, it allows us to gain a deeper understanding about eating disorders and become involved in the daily actions one can take to help those affected. Adding on, we would like to partner with associations like Canadian Physicists Research and Development Foundation and Dietitians of Canada, as it will give us larger connections so we can pitch our idea to every healthcare professional that takes care of patients with eating disorders.
People with eating disorders should always remember that with Calvosa, a mobile application that is transforming the way patients communicate with healthcare professionals, you can always receive help when you truly need it. Like always, help your Novosa with Calvosa.